right, welcome everybody. Thanks for taking some time to listen to the results from our analysis today. I'm going to discuss those results from the flu data that we've been analyzing so that we can prepare for the upcoming flu season. We all know that the United States is hit with the flu annually, which puts the strain on medical staff. In the 2016 to 2017 flu season, the US had 29 million flu illnesses. This resulted in 14 million medical visits and 500,000 hospitalizations. We know that people with weakened immune systems are much more susceptible to the flu and are at increased risk for severe flu illness, which would warrant a medical visit or hospitalizations. So the vulnerable population that we used for this analysis was anyone who was under the age of 5 or 65 and older. So to make sure that we're prepared to send staff to the medical facilities that we're partnered with, we hoped to determine which states have the highest flu rate, when the typical flu season takes place for the whole country, and then more specifically for particular states, and if the amount of vulnerable residents in a state impacts the flu rate for that state. So when we look at the graph here on this first slide, we can already tell some states that are high in the flu case count: Georgia, Alabama, Mississippi, Texas. But before we get too far into that, let's see what flu season is like for the United States. When does it start? When does it end? We decided to use 3% as a threshold for determining what starts flu season. So once the number of patients that are diagnosed with flu reached 3% or higher, we said that's the start of flu season. So if we run our mouse over here, we can see that flu season, on average for the whole United States, starts in week 50. So that is mid-December. Cases seem to really peak by the end of the year and stay high through the first 3 months of the year, and finally get back to below 3% starting in week 12. So for the whole United States, flu cases stay at 3% or higher from mid-December all the way to the end of March. We can kind of check out if there are any regions where this is different. Most of the states that we saw on the last slide were in the South, so let's just see what it looks like for the South. Looks like the southern region, definitely starts earlier in the year than overall the United States. So that's in week 46. So this means that there are going to be a few states that are definitely starting to see their cases increase before week 50. So let's hop to the next slide and see what states that might be the case for. So here we can use the sliders to kind of get an idea of what's going on in average for week 38 to 47. So it definitely looks like these southern states are all at 3%. So let's just pick one of them. We'll go Alabama. We can see that Alabama's got this timeline through the middle of the year, and they start to see a jump in cases starting week 42. So that's 8 weeks before the United States average. So that's 2 months. So if you keep kind of playing around with these sliders, you can find that Mississippi is the first state in the United States to see their flu cases get to 3% or higher. That's followed by Louisiana, Alabama, Alaska, and then Georgia. So starting in week 38, we have our first state to see that uptick in cases. So we need to be able to have enough staff to send to Mississippi 12 weeks before the country average. So let's get into what the relationship between the percent of the vulnerable population in a state and the flu deaths per 1,000 residents. So we have a few charts here to compare the top 10 states with the highest percentage of vulnerable population and the top 10 states with the highest flu death rate per 1,000 residents. So we can use the filter to kind of see, is there any overlap here? Looks like Arkansas, definitely. We've got Arkansas at slot number 10 and number 4. So we've got some crossover going on. And we find that Hawaii and Pennsylvania are also both in the top 10 for highest percentage of vulnerable population and in the top 10 for flu deaths per 1,000 residents. So this would suggest that maybe there is a relationship between percentage of vulnerable population and flu deaths per 1,000 residents. And this is reflected in this trend line here, where we can see that there is a weak positive relationship between these two variables that we're looking at. So that means that when the percentage of the vulnerable population increases, the flu deaths per 1,000 residents will also increase slightly. So that's interesting to know. We decided to do further statistical analysis on this and found that while there is that weak positive relationship, overall, states with vulnerable population percentages that were over 20%, which is the average for the percentage of the vulnerable population, didn't consistently have higher percentages of flu deaths per 1,000 residents. It means that that's not a good predictor. It's not statistically significant for this relationship. So we have more to explore on that. Overall, though, we do know now that the states with the highest flu rates that's measured either by the patients diagnosed with flu or the flu deaths per 1,000 residents are Hawaii, Alabama, Texas, Mississippi, Louisiana, North Dakota, Vermont, Idaho, and Kansas. So these are states that are likely to need the most staff from us because they do have the highest rate of flu. They're likely to need more staff than other states in the United States. Interestingly, the majority of these states are clustered in the south central region of the United States, and many of those states that have the highest flu rate also kick off flu season. Alabama, Mississippi, Louisiana, they all start flu season weeks before the typical season for the entire United States, which is week 50 through the end of week 11. So mid-December through the end of March. So we need to be prepared to send staff to those states that kick off the flu season before week 38. There wasn't a significant relationship between the percent of vulnerable population and the flu cases per 1,000 residents, but I think that this relationship is worth digging deeper into. So I suggest we gather information on vaccination rates for these age groups, the under 5 and 65 and older, because it's possible that the percent of the vulnerable population that is vaccinated is a better predictor of flu cases than percentage of the population that is vulnerable at all. since we know that vaccinations are good at protecting these vulnerable populations by boosting their immune system. We also need to gather more data on staffing ratios for these states, because we can't determine how much staff each state needs at this point. And it's possible that states with the highest flu rates have adequate staffing ratios, or that those with lower rates are understaffed. But we can't know this until we get that data to run the numbers. That's all I have for y'all today. I'm going to share this presentation via email. If you have any other questions or want more details, I'm happy to send all of that information your way via email. Don't hesitate to reach out. And thanks for taking the time to listen to this presentation today.